Dr. Awad, mentioned all the risks of obesity: type 2 diabetes, hypertension, heart disease, dyslipidemia, stroke, osteoarthritis, and a lot of these patients, come to see us where they also want to get pregnant, and they have all these, risk factors. What we began doing, and again, this was mentioned by Dr. Awad: increased ovulatory dysfunction, lower ovarian response to the meds. They tend to need lots of gonadotropins, and increased miscarriage rate, and there's decreased live birth rate from IVF, and more importantly, there's increased maternal and fetal complications during pregnancy. Weight loss improves fertility only in women that don't ovulate, because a lot of obese women ovulate and they have kids, no issues. So helping them lose weight is not really an enhanced fertility. So we're only referring to women who are PCO, anovulatory, who are obese. We began using Monjaro, and the reason why we only used it on 25 patients is because most patients were not approved by insurance. It was really hard to get approval. But the average weight loss has been 32 pounds, and some patients lost as much as 58 pounds. We use birth control pills and barrier methods. We also keep close track. And I only use it for 3 months. I mean, we're not, a weight loss clinic. We just do it for a purpose. And usually it's, for the purpose of, before IVF, we want the BMI to be less than 40. And also, for patients that we feel are high risk to conceive, we do watch TSH, amylase, lipase, hemoglobin A1C, CMP, CBC, and they sign informed consents about the medication that they're using. Like we mentioned, so we did use Monjaro. It's doing us significant benefits, and I think patients who are about to undergo surgery or about to do, IVF, who are, morbidly obese, it's probably not a bad idea to bring down the weight. If not with medications, then referring them to Dr. Awad for bariatric surgery. IVF is a simple, egg retrieval is a simple procedure, minimal, complications. But when patients have BMI, it's really risky. And, I always say this to myself: if I ever have a complication, thank God we haven't had any in 18 years, it would be a morbidly obese patient where, their airways collapse after the procedure. We did operate in the past on patients with high BMI. And as the nurses will tell you in the recovery room, I mean, sometimes it's scary. So if there is something where we can bring down their weight to at least BMIs of less than 40, wait a month before we start IVF, and then treat them with IVF, I think we're doing the patients a lot of good. So we did try the Monjaro in our clinic, and it seems to really help patients lose weight. The one thing I think we mentioned earlier, we're seeing patients with premature ovarian failure where when we do their genetic carrier screening, we're seeing BRCA2. And I know it's mentioned in the literature, but I'm doing, on all our POF patients, I'm doing the panel that screens for BRCA1 and BRCA2 because it's not part of the regular panel. And it seems to be a little more common than you would expect. So it's like we said earlier, it's almost like nature is protecting the patient. What's best to protect from ovarian cancer? To stop them from ovulating, just like birth control pills decrease the chance of ovarian cancer. And then we come along and we go against nature and we try to help the patient conceive. But we're definitely seeing that, and there will be a short presentation tonight on genetic carrier screening.